morning.
Hey, ladies.
Hi, good morning.
Good, technology is going to work.
Yes.
Yes, good.
You never know.
I have got quite a few in the waiting room, and I'll kind of wait until 10:30 to admit.
Corey, it's nice to see you. It's been a few minutes. Are
I
those your
know.
kids in the background that I get to see on Instagram sometimes?
Yes, although those are very dated, and I'm missing one who's, in no pictures in the house. Poor third child, but
It is definitely third child problems for sure.
yeah. How are things over at Riverview?
Busy, but
Yeah.
fun. I'm having a great time. It's been 8 months now I've been in this role, so a bit of a journey here.
Yeah.
Yeah. I think you've got Dave on the board right now. He was just admitting that he hasn't been to the last few board meetings. He's been a bad board member, so hopefully he'll do better by us.
That's okay. Yeah, he said the same thing to me the other day, and we get it, especially when you have young kids at home. It's hard.
It's a lot. It's a lot. Hopefully he can be a little more engaged. It's important. I'm just trying to fix my camera a little bit. Is that any better? The lighting? No, the lighting is just weird. Okay. I don't want to be in shadow.
No, I think you're good.
Okay. What a fun opportunity. Thank you for inviting me to do this.
Oh yeah.
Thank you for doing it.
Who's the next one next month?
Go ahead.
I think it's Kanye with IU Health. He's also on our board. So.
Okay. Very good.
Yeah.
Is Chad Dilly still on the board?
He's our regent.
Yep.
So technically, yes.
Did you hear about his fun role change?
No.
He's going over to be president of St. Vincent Carmel.
Really?
Mm-hmm.
Oh my goodness.
Yeah. Yeah.
I did not realize that. That's a big change.
It's a big change. It'll be fun.
Yeah.
Yeah.
I'll have to shoot him a message.
Absolutely.
Is it? I assume it's public, right?
I know about it.
Yeah. Okay.
And he gave us notice, and IU said, okay, you don't have to work the 4 weeks, and so he'll be starting soon.
Wow. Okay.
Yeah.
Good for him.
Yeah, great for him.
Yeah.
I guess it's closer to home where he lives in Zionsville.
Yeah. Yeah. It will be.
Again, young kids, always helpful.
Mm-hmm.
I'm full of the gossip this morning. You got any for me?
I don't think so. Although my brain is now going because we've been trying to increase our Ascension involvement with ACHE. So, I mean, he's going to be perfect.
Between him and Alex Overby, you should be well positioned. Alex is over at Fisher's, right?
Oh, I don't know Alex as well. So
he's a MHA alum. His wife is our liaison for the MHA program, and so yeah, so he should be strongly connected with ACHE. If he's not, that's a good opportunity for him where he is in his career. I'd like to see him do that. If you'd like for me to make a connection there, happy to. I think that's a good one.
Yeah, I'll have to check and see if he's on our roster. And Tyler, we should write his name down for a future coffee with a leader.
Yes, he would have a lot of fun to offer. He does a lot with the students in the master's program, and so this would come very naturally to him.
I was going to say, did you say Alex Overby?
Mm-hmm.
Okay. Yeah, I've heard his name.
He was a Stella Scholar back in the MHA program. I think he's been out for about 10 years. And then he went to IU he went to St. Vincent for a while, IU, and now he's back at Fisher's, is my understanding.
All right. Are you guys ready for me to let everybody in?
Please, I'm excited.
Here we go.
Look at that. I've got some Riverview folks on the phone. How fun.
Good morning. How are you guys doing today?
Hey there, Chase. Glad you could join.
Yeah, I apologize. I'm at work right now. That's why I'm in the car on the
How
meeting.
nice of you to make time to join, though. Glad to see you. Carla, look at all these good people.
So it is 10:31, so we're going to go ahead and get started. Thank you for everyone for joining our February's Coffee with the Leader session with Elizabeth Walker. She has a JD and MHA, and she's also a FACHE, and she currently serves as the Chief Strategy Officer at Riverview Health. Elizabeth has over 25 years of extensive experience in the healthcare industry, and she brings a wealth of insights and expertise to the table. So I'm excited to see what she has to say to us in this session. And Elizabeth's professional journey spans across various healthcare organizations throughout the country. So reflecting her deep commitment to advancing healthcare excellence, this is a great opportunity for early careerists to kind of engage in seeing what a unique professional journey is like. Most recently, she served as the vice president of a corporate strategy at Sinos Health, and which is a prominent pharmaceutical company. Prior to that, Elizabeth held a key leadership role, including the vice president of strategic planning and physician operations at Henry Hospital. And with Elizabeth's expertise extending beyond operational roles, she also has made significant contributions to strategy consulting for hospitals across 49 states, which is just amazing. And in navigating—
Anybody know anybody in Hawaii? I'd love to round that out. Yeah.
Yeah, let's get her to 50 states. But in navigating the challenging landscape of healthcare, her diverse background coupled with her strategic knowledge positions her as a trusted advisor for all of us. So sharing some other ACHE of Indiana upcoming events in collaboration with NAHSE, there will be a diversity in clinical trials panel held on this Thursday, actually, March 29th from 5 to 7 p.m. And then next month's March Coffee with the Leader will be moderated by Adam Hornman on March 20th with Kanye Ori, who is the Director of Community Medicine for Women's Health Services at IU Health. And also, ACHE of Indiana is also collaborating with Fairbanks School of Public Health for an alumni reception at Congress on Tuesday, March 26th from 6 to 8 p.m. And now moving on to the actual discussion, I just want to let you know, the audience, please feel free to send questions in the chat box at any time. I will be moderating it and I will try to get to them ASAP. So moving on to the questions for Elizabeth. Can you tell us a little bit about your background and your involvement with ACHE of Indiana particularly?
I've had a crazy journey that's a lot of fun to talk about, and I won't bore you with all of the details, but I was a IU undergrad in Bloomington with biology and chemistry, got into med school, and in my year off, because I did my undergrad in 3 years, I was going to go work at Eli Lilly and was encouraged to go to law school instead for that fun year off, and actually fell in love with it. It was a terrific fit from a personality and an intellectual stimulation perspective. So I stuck with the law degree and also picked up the master's in health administration, and knowing that healthcare was always where I wanted to be. Upon graduation, I did what many people do that don't know what they want to do when they grow up, and I joined consulting. And I've done that off and on for about 20 of my 25-year career with both big and small consulting firms, including what is now Guidehouse and Deloitte, as well as couple of small boutique firms along the way. Made it up to partner in a very competitive consulting environment. But I'm really blessed now to be here at Riverview, which I'll tell you a little bit about in a minute. My ACHE involvement actually has propelled my career along its crazy journey. I was encouraged early on to join ACHE, which I did in 2000, right after I graduated. Made it to fellow in 2007, and am now a life fellow. Yes, I've been at this long enough to be a life fellow now. And I've been able to serve on the board for ACHE for many years. And I remember the Early Careers Network being an idea 20 years ago, and I just love seeing that it's grown into this group today, this opportunity to learn from each other and get to know each other a little bit more. One of the things I've loved most about ACHE is the opportunity to get to know people in other organizations and just hear about how things are going and learn from each other. And as much as the people standing up as speakers in front of the room are often brilliant, I really enjoy connecting with other people that attend the events. And so I need to get to more of them again. It's been a minute.
Thank you. Moving on. So what do you wish you would have known 5 to 10 years ago about your career and building your professional mission overall?
Yeah, it's not a straight line. And I can say that a million different ways, but there is no straight path for me anyway to the top. I'm fortunate to work with another ACHE member, Dave Hyatt, who is our CEO here at Riverview, and he has more of a straight line. He was a baby CEO before he was 30, and I was vice president of a hospital when I was 27. But I did not want to ascend to the CEO role, and still do not. That's not my joy and my professional ambition. I've just had a lot of fun along the way doing fascinating work that's really challenged me. I've done hospital mergers and strategy work, as you said, in 49 of the 50 states, and learn a little something everywhere I go. And the more you see, the more you realize how much we're all alike. But there's different rules and regs in every state, and ways to structure a deal, and organizations with their own political cultures to work through. And you learn something everywhere you go. You do. And so you kind of just have to recognize that it's a journey, not a destination, as much as I would have thought rushing through school and all the things that I did early on. I wish I'd known that earlier. Yeah.
Thank you. That's great advice to say, like, it's not a straight line and everyone has their own path. I think that's important for early careers to know, especially now. Moving on to the next question. Can you tell us about a time that shaped you professionally, either through your successes and failures, especially in your unique journey?
Yeah. Oh, there's so many, but one I love to share is, again, not a straight line story, but I think COVID impacted everybody differently. And I am a mom of 4 kids. They are now 19, 17, and 13-year-old twins. At the time, a bit younger during COVID. And my husband is a family medicine doc with IU Health and was doing frontline work during COVID. And there was a necessity for one of us to stay at home and oversee these guys doing their remote learning at the time. And just given where the world was, I was not getting on a plane every week. So I was the one to step back from my career for about a year and a half. And that was a huge learning experience for me, and a recognition that there's more to life. And so as I re-engaged in the workforce, I was recruited to join Syneos Health, which is a strange bump in the journey for me, being in pharma for a couple of years at a big publicly traded company, $6 billion company that was in 110 countries with 30,000 employees, and doing important clinical trial work. It was interesting, but I wasn't mission driven in that work in the way that I am in direct healthcare, and recognized that I wanted to be back serving the community I know well in ways that I know I can impact. So learn from that experience. It was fun while it lasted, but not one I would want to go do again, truthfully. And I think you have to realize that sometimes you end up in a role that sounds good on paper, pays a lot of money, maybe. At that time too, what it did for me is allowed me to work from home, which I had come to really enjoy, not being on a plane and being away from my family as much during COVID. There were some good things about it, but it just wasn't my happy place. And I think you got to recognize what's bringing you joy. There's not enough money, right?
Thank you for that. Do you have any specific advice for students such as myself or early careers that have joined this session, or even people that are well into their careers and would just love a little refreshing advice from you?
It's mom of 4 kids, lots of busy things going on in my life. You don't have to do it all at the same time. Sleep is not just a luxury. You got to figure out how to scope out time for the things that are important to you, and that looks different for everybody. It does. For me, it has looked different at different times in my career. We, had people cleaning our house or doing our grocery shopping for us, things that, that I didn't need to do myself, but allowed me to then care for my family in ways that I found meaningful, like being at the table with them for dinner every night and driving them to their sports and things like that. I think it looks different in every different season of your life. And, where my kids are now is very different than where it was a decade ago and how I structured my days in my life. I think you got to just acknowledge that there's seasonality to it and lean into wherever you're at. And it all kind of just keep finding people because you never know. The story I love to tell about Dave, who is our CEO now here at Riverview, is he was actually an intern at one of my early consulting firms. Not necessarily my intern, although I love to claim I'm only 8 years older than he is. But I found him. That's how I first met him early in his career, and just kept in contact with him. And did his merger when he was at Jay County Hospital into IU Health, and you just keep finding people along your path that you want to connect with. And then when he got this role as CEO, I was a call to backfill the COO CSO position, and that's a fun story too. They hired me to be the chief operating officer and strategy officer, and compliance officer, and I'm trying to think what else. There were a couple other titles under there. It was a big job. And after about, I'm 8 months in now, and after about 6 months, we rethought it and restructured it to be more fit for what it is that I can only do well in this organization. There are a lot of people in this organization that can operate well and do operate this organization well. And so those duties have been shifted over to other folks, and making more time for me to focus on the interesting strategy work, which is how my brain is wired. And just given where Riverview is in a particular moment in time, in the very competitive environment of Hamilton County, we're the 6th fastest growing county in the nation. Trying to figure out how to serve that growing population is what's taking up my mind and energy. And others are focused on making sure that the lights continue to run and all the right things that need to be done.
Thank you. There's a question in the chat from Adam. He asks, what are traits that you look for in an early careerist that would indicate they would be a successful leader? Sorry.
Oh, yes. I think agility. Somebody who recognizes that they don't know everything, but are willing to learn and show those high EQ skills to be able to lean in and learn wherever is needed in the organization. I hire as much on that as I do on the resume. And again, my resume is a crazy one. It jumps around with a bunch of consulting firms, but you need to be able to tell the story of what it is that you enjoy doing and what it is you think you can contribute. And hearing that directly, Adam, I'm curious about how that answer resonates with you. Would you say that that's how you're getting interviewed, or how you've seen others be interviewed as an early careerist?
I can talk faster than I can type. Yeah, I would definitely agree. I would just curious. I feel like I get a different answer from everyone, but it all kind of stems around being flexible and being able to bounce around effectively and manage those items like that. So I appreciate that.
Yeah, I think just given where healthcare is rapidly evolving, we got to be able to keep up with it. And who knew coming out with the degrees that I had, a law degree and a master's of health administration, that I would be so uniquely positioned now to be able to address some of the strategy things that we are faced with as a healthcare industry. They're good tools in the toolkit, but 25 years ago, did I know that was going to equip me well for my career? Heck no. It just kind of opened a door for me, which was great, but happy accident for sure.
Thank you, Adam, for asking that. And thank you for answering, Elizabeth. We're going to open it up to the audience to see if anyone has any questions to ask you. You can get off mute and ask, or send them to the chat box. I'd be happy to read them off.
Oh, come on, don't be shy, guys.
Yeah, not all at once now.
This is Justin Kelly. I don't know if you can hear me.
I can. Yeah.
Hello. Good morning. One of the things that I'm kind of struggling with, because I have a little over 10 or 11 years in kind of middle management and healthcare operations. And like you mentioned, not a straight line. I had taken a chance on myself to work for a dental service organization startup, and it shut down very quickly, about 3 or 4 months after starting. And so during that time, I was still in the process of achieving my degree. So I felt like I was getting filtered out through the process of interviewing. And really, I was just curious what your recommendation on trying to tell that story without it feeling like I took a step back due to anything other than just being able to provide for my family and also have, a career and still keep moving forward.
I think you've just told that story well. It's you've learned from different experiences, gotten the education, you're ready for the next thing. It is weird to me how the algorithms can weed you out though. And so that's where I then again lean on the network. Again, I'm here at Riverview in part because of the relationships I've fostered here over a number of years, not just Dave. I've done strategic planning work off and on with this organization over the last 25 years with all the previous CEOs. And so I was a known quantity in some ways to this org when they hired me. And that is true of many of the places where I've gotten hired over the years. So I would just encourage you again to be able to, as you just did, speak to that story to folks that you know, and a position will open up at some point. Until then, just keep at it. It's hard, isn't
Yeah,
it?
I definitely appreciate that because, the background, it just looks like, the resume, it reads as like, jumped around a few times
Yep.
and that was not the intent.
No.
But I still want to continue to move forward because I feel like I'm about to finish my master's degree with organizational leadership. And I feel like I need that. I in my career, it's to take that next step and to feel like I'm just kind of like stuck trying to tell this story of that, rough time between 2022 and now. It's just kind of unique.
Honestly, when we would hire young interns at Deloitte, I was on that selection committee. People that could tell of a hardship were higher up in the ranking than those who had had an easy glide path, because they knew that they would overcome the challenges that they were going to be faced in various consulting engagements. And so, own it. Just own the challenges you faced and what you've learned from it, and be able to speak to that. But it's not your whole story, is it?
Awesome. I appreciate that.
Yeah. Andy, I see you with your hand up.
Yeah. So Elizabeth, curious, what do you think are the greatest kind of issues facing kind of future healthcare leaders? What are going to be the challenges over the next, 5 to 10 years that they're going to have to face?
Oh, where do I start? This is all I think about, right? So we at Riverview have been rolling out a new strategic plan, and our number one pillar, it's the same 5 pillars I think most orgs have, but the number one pillar is people, and being able to attract and retain the right talent to be able to support this organization as it evolves. It's a challenge for every single healthcare organization. I think there's not enough nurses out there still. There's not enough docs. There's not enough providers. There's not enough smart people willing to do the hard work that needs to be done ahead. There's easier places to work, like pharma, honestly. There are easier industries, and so we lose some good folks along the way. And so as our organization is thinking about how we're going to show up and lead, supporting our folks is a big piece. We're launching next week, actually, our first Review Leadership Academy, which will have 81 of our leaders cycling through here in 2024, learning about the things that they need to do to be effective leaders in this organization and then support their staff. And it'll keep trickling down to the next layer and to the next layer and to the next layer in the months to come. But I just having people be ready for all the change that's ahead feels to me like the heaviest lift right now. Certainly, there's a lot of partnerships out there and a lot of tech to be dealt with. We are actually looking at our Epic EMR and trying to think about if we're with the right partner right now. And, that's going to be a huge lift for our organization, even if we're going to go Epic to Epic to lift it from one thing to another, what that might look like. No shortage of challenges, but it all comes down to whether or not we have the right people to do the work and take care of our patients in the way that they need. Does that resonate with you, Andy? You're seeing a lot across the state. Would you?
Yeah,
what would you guess I would have said?
I would agree. I mean, I think, sometimes I say workforce is a mathematical equation. I think the real challenge is there's not enough people. And so we have to think about how we deliver care differently. And we always say do more with less, but it really is going to be there's not going to ever be enough doctors, or not going to ever be enough nurses, or and then I think also healthcare in the past, we didn't compete with other industries. Now we're
No,
competing
now we
with,
do.
with technology, with logistic companies, with not just within the healthcare vertical, but with other industries. We're competing directly with talent.
We are, and our patients are going to demand that we are behaving in a way as those other verticals do, to be able to have same day access, to have more interaction and support beyond just the physician patient encounter that typically has been the focus. That's a really interesting point, Andy. Yeah. See a few questions in the chat. You want to raise one up?
Thank you, Justin and Andy. Tyler asks, is being vulnerable and honest, for a lack of better words, the best way to tell that story? I think in regards to Justin's story, probably.
Yeah, I think that comes pretty naturally to me as I've progressed in my career. Certainly earlier in my career, I overcompensated with all the initials and credentials and hid any kind of struggle that I had. But I think folks that are able to just speak honestly and openly about what life has brought them, I like hanging out with those people more. I don't know about you, and I respect that if you're able to own that in ways. Does that answer your question, I hope?
Yeah, definitely. That's kind of like being too vulnerable sometimes. It was a little weird, but I
Yeah.
agree with you. I enjoy being honest and upfront about, life's struggles and how you overcome them.
How you show up is how you lead, and who you are is how you lead. And so I think you show up as a whole person at work. And so the fact that I have 4 kids and I manage a household actually applies to how maybe I show up as a leader and manage this org, right? And so you got to be professional, and maybe you don't overshare that about things, but it all overlaps. And I think the more we talk about things, the more integrated we are, and the better we can then show up in our teams. That's my view anyway. And I hope you guys are experiencing that at your orgs as well.
Thank you, Tyler. Moving on, Alex asks, how does Riverview plan to continue caring for Hamilton County given the drastic rise in population of Westfield and Noblesville specifically? And off this, and based off what you said about how there's not enough nurses, doctors, etc., how has Riverview been able to keep up with that patient care / keep the beds open?
Yeah, this is a great question that I think about all the time. And we at Riverview say everything starts with primary care. Everything starts, and I'm married to a primary care doc, so I do have a bit of a bias in that equation, but everything starts with that relationship. And so we have invested over the years in our 3 independent freestanding emergency room urgent care facilities, as well as our 2 hospitals across this community. And now we're populating more primary care docs in between, because patients like to seek care closer to home. And also are working aggressively on building up our capacity to offer same-day virtual services. And that won't just be physicians. As much as old school physicians have typically had an aversion, the advanced practitioner is critical in improving access points for patients along the care continuum, and not just for primary care, but also for specialty care. So as we hire, we are looking at more of that 1-to-1 ratio. We're not anywhere near it yet today, but we'd like to be closer to that to be able to improve the amount of access patients might have to us. So there isn't enough out there. And so truthfully, we're trying to grow some of our own. We are trying to, be a magnet, be a place where other organizational people who may be frustrated with the bureaucracy and the lack of connection to purpose may be able to find a home. There's no perfect answer to that, and we are trying to be creative, as you can imagine. Interesting thing about technologies, though, like virtual nursing and bedside sitters, and we're trying to figure out how to leverage those as well, again, to make the people that we have go as far as they can. Yeah. See some more questions. I could talk about that one all day, though. Find me another minute. I'm happy to chat.
Thank you. Question from Brandon. How have you handled situations where you don't fit the specific requirements of a position, but the position speaks to you on a personal level, but you continue to get filtered out because you don't meet those requirements?
Yeah.
And He also stated, being a clinician, I often feel like I get pigeonholed no matter how hard I try because I get identified as only knowing the clinical side despite my experience and education. I feel like this is more apparent on the nursing side rather than the physician side of things. So how do I break out of that?
Oh, good question. Really good question. Brandon, I don't know about your specific credentials, what kind of clinician you are and whether education you've had. Certainly the credentials are helpful in helping you beat through those filters. And so if you're not already, I would definitely encourage you to become a diplomat or a fellow within the college, because those credentials show that you would like to be in healthcare administration beyond just your desires. Again, I don't know about your specific story. I think this is where personal connections come in. This is where getting to know people in professional and social settings like ACHE, like Executive Women in Healthcare, like HBA, which I'm also a former board member. I'm HFMA. There are so many good ones out there that just give you the opportunity to interact with folks and just getting to know people and sharing how you think that might be a fit here. One of the people up here in the C-suite with me, Nikki Sweeney, is also an MHA, but started her career as a chiropractor. Right. So and now she's our chief ambulatory officer over all our physician practices, lab and physical therapy and all the things. You can do it. It's just you got to be able to kind of weave your way in. And would she have been hired for this role with just a chiropractor license? Probably not. It was probably the master's for her that helped open up that door and have her work her way up. But I'd be curious to hear more about your journey, Brandon, at some point.
I'll just give you my back. So I have a doctorate of nursing practice, an MBA. I'm an RN, FACG, and CPPS.
I don't know then. Gosh, Brandon, you're more educated than I. Goodness. We have another gentleman on our team, Dustin Mikesels, who might be fun for you to talk to, who's also an MP MBA and is working his way up in the org structure. It's I don't know, Dustin, are you on the call? Chase is on the call that is on his team. There's all kinds of places to plug in. I think you just need to find your in somewhere and grow there. I'd love to talk to you more though. Make sure you contact me after this call.
Thank you. I think we have time for one more question. If no one asks, I will take it away.
This is so fun. Thank you for giving me this opportunity to interact with all you guys. You can tell I'm getting energy from this. It's not easy being in your shoes as an early careerist, nor is it as a mid-late careerist, as I guess I am at this point. But I have lots of empathy for you, and I wish you well in your journeys. It's going to be a fun one. Who could have predicted the way healthcare would evolve, where it is today, and where it's going to go?
Okay, so the last question I have for you is, why did you become a fellow for ACHE?
Yeah, I think for me, as a young female, I was 23 when I came out of my out of law school and master's. I felt very young compared to everybody, and I was very young. I was young and stupid, really, compared to everybody else in the room. And I felt like having more credentials for me would give me some gravitas entering into these boardrooms and these strategic conversations with executive suite. I felt like I needed more credentials. What I found though, is it was more than the credentials that it got me. It was those connections with people. I was able to meet people in informal ways that helped me grow in my career and my development and learn more about what was out there for me to do. And I'm grateful for that. That I would honestly say I was chasing letters at the time. I didn't know any better way to get the recognition as that young female. It's gotten a lot better, but I still, here at Riverview, we only have one female on the board. It's still pretty male dominated, at least here in the county hospital area.
Yeah, thank you. Sorry, Carla, I missed your emoji, but I think we can squeeze your question in real quick.
Thanks. So I was just trying to come up with that last question, try to help you out. But my question for Elizabeth is, I know you've been in healthcare, you worked at Henry County and other places, but then you kind of made that transition out of the healthcare environment. Now you're back in. So what surprised you, or what has changed, I guess? I mean, healthcare, I feel like it's gone through such an evolution. Like, What, when you came back and now you're at Riverview, like what surprised you the most?
Oh, so many things. How much it hasn't changed. It is still about the patient. At the end of the day, it is still about those patients. One of the things I love about this place that I'm so proud of is everyone will stop in the hall when they see a patient's lost. Every hospital that I've ever worked in is a bit of a maze, and everyone to the person will stop in the hall and help that patient find their way to the next thing. There's these beautiful interactions in the cafeteria with patients' families that I get to have every day when I go down for lunch or breakfast, and that hasn't changed. And that's the gift of being in healthcare. I don't touch patients. I don't have that sacred space where I lay hands on people to make them feel better, but I know I am impacting folks in the work that I'm doing. And that feels so darn good.
Great, thanks.
Thank you, Carla, for your question. And thank you once again, Elizabeth, for joining us for this month's Coffee with a Leader session. And thank you everyone for joining and your great questions and a great conversation. I hope everyone has a lovely Tuesday and a great rest of your week.
Thank you.
Bye.
Thank you.
Thank you.